Displaced populations have numerous health challenges, and providing them with quality medical support is necessary.
The international community of the Red Cross has been providing life-saving support to victims of armed conflict and accidents. This year alone, the surgical team of the ICRC in Maiduguri have carried out more than 1,450 surgeries.
Now, a spokesperson, ICRC in Nigeria, Aliyu Dawobe, joins us now from Abuja on Skype to discuss this issue. Aliyu, it's good to have you join us right now. These are unprecedented times, and it's really challenging how managing issues of COVID-19 and also keeping up with with healthy lifestyles and the challenges that people have to work with. Can you talk to us some of the challenges that you come across trying to care for people at times like this?
Thank you very much for having me. And yes, we in trying times like this, when we have COVID-19 and we also have to pass through a lot of health challenges of populations that are affected, this is something that is really very, very severe on the people that are affected. You can see from the figures, we had 1,450 people were supported by surgery this year alone. So this is something really serious, and it's been very, very tedious sometimes to get access to some of the people that are affected. So generally, you have people that are affected, and then you also have to look at how to be able to manage them, especially when they come and you have to abide by the guidelines of social distancing, wearing of mask, and proper hygiene. So all these are one of the key things. But the major problem we are having is actually people are affected. People are injured sometimes. People need medical support from people, from organizations, from medical facilities, and so on and so forth. So these are some of the key things. And if you look at the situation in the northeast of Nigeria, where you have millions of people that are in need, this is something that is really, really very severe on the population. You have millions of people that are in need, and then you have millions of these people, or hundreds of thousands of these people, don't have access to some of these basic needs, especially basic needs that have to do with health. We are talking about over 2 billion displaced people in the north of Nigeria. And then these displaced people, over 80% of them are not staying in camps. So for those that are staying in camps, you have organizations try to work to see how they can support them in terms of health. But those that are not staying in camps will have to stay communities. Host communities are stayed with host communities that also don't have basic health services where they are feeding. So now there is an additional burden to these host communities that are hosting the displaced people. This makes them
all right, Aliyu, I'll have to interrupt your line of thought right now. In spite of the challenges faced by the ICRC, it was still able to carry out 1,450 surgeries so far in the midst of the thousands of people needing medical attention. How was it able to achieve this in spite of the challenges you have pointed out?
Most of this, when crisis happens, you have people injured. So when we get information about these injuries that I obtained, we also try to look at possibilities of us having access to these people. And then when we have access to these people, we evacuate them from where they are injured back to Maiduguri, where we have a medical surgical team that is waiting and willing to support these people. So you see, it's been a long process. It's been for more than 10 years we've been doing this, and this is just a figure that we have brought out within a year. So this is very pathetic that people will have to suffer like this, but we also have to respect all the guidelines. If they come into the medical surgical ward, the medical surgical team will have to pass them through some screening to make sure that some basic guidelines respecting this pandemic that we are in are respected. And then they are treated in this medical surgical team. They are monitored. This medication is not like they pay for it. It's something that we give out for free to these people, because we know they don't have anything. Even if they do, it's a free medical support that we give to these people.
All right, Ali, you talk to us. We know that there are a plethora, a large number of people who need these attentions. But who qualifies to be attended to and who doesn't? Or what magnitude of those, or who falls in that criteria? Or who is eligible to be cared for at this time when it comes to surgeries and all of that?
Talking about eligibility is once someone is injured, he's eligible. So what we do, if we have an overwhelming number, we try to concentrate much more on the most vulnerable people. We look at the situation and try to see who is much more in need than the other one. So it's something that does not talk about who qualifies. Everybody that is injured has the right to health, has the right to medication. So this is something that we are trying to do, except if we have an overwhelming number, and then we will have to prioritize, see who needs health the most and who can sustain, who can be managed, and then later on get also medical help. But definitely we will look at both people that are affected and try to see who is in their need of support so that we can save his life. But then generally everybody has the right to medication and health.
Now, talk to us about concerns that you have in trying to reach out to people to address these issues, especially when it comes to the health challenges faced by displaced persons.
Good morning, and thank you for having me again. Challenges in health situations in the Northeast is something that is very critical to the organization. Access is one of the key challenges we are having. Most of the times you have people that are affected, injured out there, but then having access to bring them down to medical facilities is one of the key challenges we are facing. But then we've been trying all the best to see what we can do, to see how we can support these communities. You have seen in the tweet we met yesterday, 1,450 people were affected, and we were able to evacuate many of these people to the Maiduguri Specialist Hospital, where we have a special medical surgical ward where we are operating and treating critically injured people because of the conflict going on in the northeast of Nigeria. This has been going on in the last years. This has been very, very tedious for us to do this. Most of the times you have conflicts happening like in Monguno, in the northeast of Nigeria, in Damboa, and the rest of them. When we get information, we try to mobilize our resources and move these people in a safe way so that they would be brought into the Maiduguri Specialist Hospital, where we collaborate well with the state government, and we have a special medical surgical ward that we operate people that are critically wounded in this situation. So this we've been doing over the years, and we were able to, in this year, to do surgeries of about 1,450 people, as we tweeted.
All right, Aliu, certainly surgeries for over 1,000 people is not, would certainly not come cheap. Talk to us when it comes to issue of funding. How easy is funding coming for that operation?
Yes, funding is one of the other issues we will have to look at with the limited resources we have, but still we are trying to do our best. Yes, of course, you have hundreds of thousands of people needing support. So what we do is just to try to limit our activities or our support to the resources we have. So this is what we are doing. Like if you look at the northeast of Nigeria, you are going to see almost all the health structures that are in the rural areas, what we call in Nigeria the primary health centers, have been destroyed and are no longer functioning. Not that they have been destroyed per se, but when they are abandoned and the healthcare services are not being provided and the communities are not there, they will definitely be destroyed because people are no longer using them. So when populations are moving, they don't have this luxury to move together with their health facilities. They leave them behind, and they also leave some medical people also leave these areas, and the access becomes very, very tedious. And we've been trying to support the primary health centers where we are operating in the northeast of Nigeria, so that children would be supported. Especially malaria can be one of the key problems that can affect children.
Aliyu, there's so much that we know you would like to talk about, but because of want of time, we have to leave the conversation here now. Aliyu Dawobe, spokesperson ICRC, thank you for joining us on The Breakfast Show.
Thank you for having me. Good morning again.